I, for a while, was sponsored by the Inside Tracker, and it was interesting to me when I was on their program how I was able to move my own biological age back over a decade by doing simple behavioral change interventions, supplements, and really examining what my blood level was and how my gut microbiome was functioning, and then doing things to better it. So this stuff definitely works, as I saw through my own experience doing it.
Mhm. And I think the key is that oftentimes as humans, we want immediate gratification. We want to see things change tomorrow. The line that we typically use is that it took you 40 years to get to where you are. It's going to take time to optimize your health. And that's really the key with health optimization, medicine, and practice is that it's a long-term idea. It's a long-term plan. It's not something that's supposed to happen and help you immediately, although it can, absolutely, especially when you're using things like nootropics and sleep and other things that can help you along the way to help you right now with mitochondrial function. But the idea is that if you want a sustainable health foundation, this is going to take time to optimize levels of vitamins, minerals, and nutrients. This is from your experience, I'm sure, too, John, when you were going through it. It really is something that doesn't happen overnight. And certainly you can make changes overnight that can have significant benefit. But oftentimes with our patients, it's like, well, I didn't get sick this year. Or when I did get sick, I only was sick for 2 days as opposed to 14 days. When I went traveling, I didn't have jet lag that was so terrible. I only had jet lag for a day versus a week, or et cetera. You can fill in the blanks. Oftentimes, unfortunately, our health is in the rearview mirror. We're looking at it from the back, right? Instead of being more proactive about it. The idea with health optimization medicine is, can we train practitioners? Oh, and I forgot I didn't answer your original question, did I? Can we train practitioners to use this in their practices so that they can use this in combination with the other things that they're doing? So for me, it's hyperbaric therapy. For somebody like a chiropractor, it could be along with chiropractic manipulation and other kinds of things. For a cancer doctor, it can be used as something as a foundation in that capacity too, because it's not mutually exclusive to anything you would do. You want to have optimized levels of antioxidants if you have cancer, or if you don't have cancer, or if you're a high level athlete, or et cetera. But to answer your original question, which I completely blew, sorry about that, is we're a new organization. There's not that many of us. And what we're hoping to do, we're having our first cohort of practitioners that are finishing next month in July of 2023. And we're looking at repeating this in September. So definitely interested in talking to practitioners that are thinking about adding something to their practice. They're interested in a health focus. They want to keep what we say is setting disease aside for a little while and just focusing on health. And that was very provocative for me as a son of a chiropractor, because I really knew that's what I wanted to do with my patients, is focus on their health, and then everything else would get easier.